Hello, this is Robert Ferguson, your nutritionist, America's fat loss coach. And you know what? Dr. Dre has suffered an aneurysm, and that is not a good thing. And there's a lot of people wondering, like, what can we do? What could he have done to have avoided the likelihood of something like this happening? I guess number one, like, what is an aneurysm? In short, an aneurysm is the weakening of the artery of a blood vessel that travels in the brain. Matter of fact, there's about 30,000 people that experience a rupture as a result of aneurysm, which is not good. Oftentimes, a person can die as a result of that. Over 6 million people experience aneurysm, and aneurysms, like, it just happens. And some of the risk factors for why it happens or to reduce your likelihood includes, one, if you're over the age of 40, then you have an increased likelihood of something like this happening. And Dr. Dre is over the age of 40. Smoking. If a person smokes, yes, another reason why you may want to stop smoking. And that includes someone who smokes regularly and someone who smokes occasionally. Smoking's not helpful, you guys. Let's not do that. And if you don't want to experience an aneurysm like Dr. Dre, then this is a good time to stop smoking. High blood pressure. Think of all the people we know, and it may include you, of people who are dealing with high blood pressure. That is a risk factor. It's associated with a higher likelihood of a person experiencing an aneurysm. I don't know if Dr. Dre had high blood pressure. I have no idea. But we do know that it's a risk factor. Heavy alcohol use. If you're drinking heavy, and I think we all know what heavy is. If you're drinking heavy, cut back. A glass of wine, a drink here and there. That's not what we're talking about. We're talking about people who are over consuming alcohol. So if you're getting a buzz every time and you're doing this on a regular basis, this is another reason why you may want to cut back. And if you have a tough time cutting back on your alcohol consumption, it may be time to stop it altogether. Drug use is also associated with an increased likelihood of experiencing an aneurysm. If you're doing drugs, we all know that's not helpful. So cut back, reduce your risk. Aneurysms happen a lot, more often than we realize. And oftentimes they can lead to that stroke that results in death. Okay, now this one is going to get you. Okay, it's going to get you, it's going to throw you off. And that's because if you are female compared to being a male, if your genetic makeup is that of a female, then you have a higher risk of having an aneurysm compared to a man. Now, no one knows if you're going to experience an aneurysm or not, but we do know that being a woman increases your likelihood of it happening compared to that of a man. Family history, yes, it comes up. If someone in your family has experienced an aneurysm, I wouldn't walk around overly stressed out and concerned that it's going to happen to you. However, it does play a role in an increased likelihood of you experiencing that. So I think you get what I'm saying. So, you do the best you can. You live your life the healthiest you possibly can. Things are going to happen to people. Who knows? I mean, people get cancer who are the epitome of health. We have no idea. There's so many things we don't understand. However, if it's in your family, and someone has experienced it in your family, then that's another sign that you want to take steps to living your healthiest life. And there's various medical conditions, and I'll stop here because you want to consult with your doctor. The next time you're in and you meet with your physician, ask your doctor about aneurysms and ask if there's any medications or if you have any medical conditions that may increase the likelihood of you experiencing an aneurysm. I personally want to wish Dr. Dre the best when it comes to recovery. No one wants to experience such hardships and stress and life, and we all are going to leave one day, but in reality we all would love to maximize our time on this earth. Now, with Diet Free Life, we help people live their healthiest and happiest life. we put you in a position for you to be successful. Also, when we post these types of videos, our goal is to educate people, because we've learned that as a result of being better informed, people are then positioned to make wise decisions. And then they build a confidence. And with that confidence, they then experience a continuance of success. So there's no food that you can eat, there's no way of exercising that you can perform that's going to, take you out of the risk of experiencing an aneurysm. It happens, and we don't know all the answers, but we do know that when you lead a healthier life, one that doesn't include a lot of stress, and you're taking care of yourself, you're not smoking, you get your blood pressure down, you remove yourself from all these morbidities, then it puts you in a position to thrive, or at least make the most of what life is making available to you. So anyway, thank you. Please comment, subscribe. If you have questions, we're here to help you. I want you to thrive. I'm Robert Ferguson, America's fat loss coach, your personal nutritionist, and someone who shares because he cares.